Can females undergo hair transplant? If you are a lady who has a show of scalp, the hair thinning is there on the top and the front of scalp, so much so that you don't feel good about it. If you don't want to go to a party, you don't want to meet people, you feel everyone is watching your top of head only because there is so less hair on it and the scalp is so much visible. If you have a hairline, frontal hairline, which is so high that you feel your forehead is so large, it is abnormal. You cannot do a pony, you cannot make a bun, you cannot make a French knot because you have to make your hair lie flat on your forehead because the hairline is so high that you don't want to highlight the high forehead. These are basic problems with high forehead and visible scalp. If it is that and you don't know what to do about it, how to seek help, then this video is for you. Today we'll be discussing together whether hair transplant is feasible for females or not, what results can you expect by your hair transplant, what are the side effects that can happen, what complications can happen, and how to actually go about it. So this can be a concise guide to your hair transplant procedure. My name is Dr. Preeti Saraswat. I'm an American board certified hair transplant surgeon, and for more hair related videos, you can always subscribe my channel. Addressing the important question first. Can females undergo hair transplant? The answer is yes, they can. A female can definitely undergo hair transplant if hair transplant is indicated for her problem. The main reason for such baldness in females, if it is there in the front and the top of the scalp, is female pattern hair loss. Female pattern hair loss can be classified very easily in Ludwig 1, 2 and 3. So if it is Ludwig 1, Ludwig 2 is worse, Ludwig 3 is even worse. It covers almost whole of the top of the scalp. So in any of these type of hair losses, by consultation with your doctor, you both can very well decide if hair transplant is needed. Apart from that, if you have a very high hairline, you can definitely want to lower the hairline by means of hair transplantation. Now, how will we find out whether hair transplant is suitable for you or not? The main thing which decides this is trichoscopy. By means of trichoscope, we can decide what is the diameter of your hair at the back, which is the safe donor area. If it is good, if it is terminal, we have to take those grafts and we can always put them here in the front so that you have a good hair and you have a lowered forehead, whatever the indication can be. If the trichoscopy does not allow hair transplant, there can be other non-surgical methods which can help you, which I am definitely going to tell you by the end of this video when we'll chalk out the major points. If you feel this information is useful for you, please hit the like button. So what can be the problems which can occur in a female hair transplant? Let us discuss first the problems which the patient can feel. The first problem can be there can be shock loss or telogen effluvium. It means you can lose your hair at the donor side as well as on the recipient side. The recipient side, those hairs which were present previously. So this is a major disaster for the patient. They feel, I was there for hair transplant, I wanted to grow more hair, now I'm losing the hair. So this telogen effluvium or shock loss is a known phenomena. It will happen when you undergo a hair transplant because of the procedure of hair transplant. The roots which you already have will undergo certain shock. They will shed off the hair, but that hair will grow again in due course of time later on. Then the second problem you can face is pain. The pain is not too much, but then again, the pain threshold for different people is different. There are people who can tolerate a lot of pain, no problem at all. But then there are certain cuties which will not tolerate that kind of a pain, even a little pain. So this can be variable. The third can be little swelling. This can be little, this can be a little more, depending upon you as a patient. So every tissue in your body, when we do some procedure around it or over it, it is bound to experience some swelling. This swelling can come to your face, but definitely it is for a limited period of time and it will go away as soon as it came. So rest assured, this swelling is not there to remain. The next limitation can be that when we do a hair transplant, when we make the slits or we implant the graft, we cannot mimic the density which God has given us. The density at the back usually is 80 grafts per centimeter square, but what we can do achieve in the front is almost 50% of that. So you can have some visibility of scalp even after hair transplant. This is the limitation of the procedure. This is acceptable to 90% of the females, but there are people who want very good density. So sometimes they do come and they opt for a second procedure, or they can have one non-surgical assistance too, which I'll definitely consider towards the end of the video. Then another Another thing can be you need to have assistance both at work and at home when you are undergoing this procedure, because actually it's a surgery. You have to be mentally prepared for this surgical procedure and you have to be the tough one. If you want to ask anything, you can always write in the comment section below regarding your hair loss or your scalp visibility, and whatever we can do to help you out. The next challenge which is there in female hair transplant is for the doctor and his team. Now in female hair transplant, we cannot shave the recipient area. We have to put the grafts in between the long hairs only, whether you have short hairs or long hairs, whichever hairstyle you are sporting. So we do not intend to shorten or shave the recipient side. So in those cases, it is always a bit difficult and it needs skilled people to put grafts in between the long hairs, and you can have longer working hours. And not only the tools have to be very efficient and new, and whatever new technology is available, and also the staff has to be skilled and experienced. If you have any question regarding your hair transplant, you can always call us on the numbers below. So how do we deal with female hair transplant procedures and how do we take care of it? So in this, there can always be chances of more bleeding because we are not using adrenaline to prevent shock loss. So in these cases, we need more staff, we need better equipments, we need skilled team and longer experienced team along with proper credentials of the doctor. So the doctors should be American board certified and members of various organizations, national and international, like ISHRS, AAHRS, AHRS, and the team should be a well-trained, skilled team working with us for more than a decade. So once you enter such a center, you get a good consultation, you get the trichoscopy done, and then you opt for your hair transplant because you want to get rid of this baldness. So in these cases, the instruments can be challenging and they can be very specific too. You can have a classical FUE or you can have a long hair FUE in which you need window punch or a trumpet punch, or you can definitely have non-shaven FUE in which you need very good specialized instruments again. So the skill, the instruments, everything needs to be perfect for a very good female hair transplant result. In regarding to the female hairline, there are very advanced systems now. We can have a S-shaped hairline, we can have inverted S hairline, then we can have a concave hairline. Why so many types? Because according to the face of the female, whether it is round or it is square or it is already oval, we need to achieve a perfect hairline which makes the face look even better. And by better, I mean the facial contour can be improved by your hairline. So this has to be worked upon very nicely, taking proper time, giving proper attention, and then we can decide your hairline if you have a high forehead. If you are undergoing postpartum hair loss after delivery of your young one, you can definitely recover from it, and how to do it and what are the different steps and what all things you need to know about it, you can always click on the video above. In those of you in which we feel the hair transplant will not be able to cover the whole of your baldness, we can always opt for hair transplant in the front so that you get a volume of hair, and then SMP or scalp micropigmentation towards the back so that the scalp visibility is reduced to a minimum. Keeping the cover of hair in the front and SMP at the back, you are given good result. So SMP is the procedure I was talking about. It is a non-surgical procedure, medical procedure. It can be done without shaving of head, without any blood tests, and if you want to know more about it, you can always click on the video above. If any of your family members, friends or loved ones are having this problem of female hair loss and they want to get a hair transplant done, you can always share this video with them and you can subscribe our channel for further such information. If you want to know the medical treatment which is US FDA approved for females, it is minoxidil, and to know more about it, click on the video on the left. Thank you.